Senate Health and Human Services Committee. I'd like to get underway, and if it's okay with everybody, we're in 313, which is a very large room with 2 windows open, and the closest person to me about 12 feet away. So I'm gonna take my mask off. So we're going to start this committee with an attendance to meet a quorum.
Senator Bell.
Present.
Senator Culkin.
Present.
Senator DeMario.
Present.
Senator Golden.
Here.
Senator Lawson. One more time, Senator Lawson.
Are you here?
Thank you. Chairman Miller.
Here.
Senator Valverde.
Here.
Whip Goodwin.
I'm here.
Mr. Chairman, you have a quorum.
Thank you. So those of you who have followed since our meeting last week and the beginning of Senate session, Health and Human Services is started very early on hearings. Last week was our first hearing, and I believe it was the first Senate hearing for the session. And we have been, our priority has been COVID-related legislation. Last week we heard bills that dealt with telemedicine and also the ACA. And following with that theme, this week we're going to hear 3 bills that also are urgent and in the context of the COVID pandemic. The first bill will be Senator Goodwin's bill on nursing home staffing levels. The second bill will be Senator Lombardi's bill on nursing home patients, and the third bill will be my bill on Harm Reduction Center Advisory Pilot Program. To start off with Senator Goodwin's Senate Bill number 2, which was a bill that we passed last session, requires that beginning July 1, 2021, nursing facilities must provide a minimum of 4.1 hours of direct care per day to each resident. 2.8 of these hours must be provided by a CNA. Department of Health is charged with establishing rules and regulations regarding compliance and enforcement of these minimum staffing requirements. The bill also requires that the General Assembly appropriate $600,000 for the Department of Labor and Training to issue grants to nursing facilities for enhanced training of direct care and support services staff. Additionally, the bill mandates that any nursing facility Medicaid rate increased occurring after October 1, 2021 must be applied toward compensation increases for all direct care workers. We are very fortunate to have as our first person to testify, and she's on both WebEx and voice, is Senator Goodwin. Senator Goodwin, are you ready to join us?
I am, Mr. Chairman, and thank you very much for hearing my bill and hearing it first today. I know you all have a lengthy agenda. To the returning members of the Health Committee in the Senate, you're already familiar with this very important piece of legislation. It passed unanimously last year in the Senate, but got held up, unfortunately, in the House. And I think with this current situation that we're here with this pandemic, this bill is even more necessary than ever. And Mr. Chairman, you did a great job outlining the 3 basic principles, including in this bill, providing for a minimum staffing, first and foremost, most important, of 4.1 hours a day for nursing home residents. I often say when discussing this bill, I wonder how many families in Rhode Island even realize that their family members in a 24-hour period aren't even getting a minimum of 4.1 hours. I mean, it's sad. Of course, as you said, Mr. Chairman, it provides a path to a living wage, and it would increase reimbursement to our frontline workers. And lastly, it would access and resource for more training, and we see how important that is, especially around infection control these days. It also requires that the data become public for the public's consideration. I think that's very important before anybody makes that decision as to where they're going to put a loved one into a nursing facility. You can see their ratings that would be provided in a very public way. And lastly, there are fines included for those who are non-compliant in this matter. And so let me just begin to say that even prior to the pandemic here in Rhode Island, we've faced a staffing crisis. We rank number 41 in the entire country. We are an outlier. We are the last to have every New England state around us has a minimum staffing requirement, except Rhode Island. And essentially, folks, that's a real disgrace. Given the human toll that we have been seeing, especially during the pandemic, the status quo in nursing home staffing is really unacceptable. And we have a chance here today, ladies and gentlemen, in the Senate in the next few weeks to make some very important changes. We see that over 60% of the COVID-19 related deaths have occurred in nursing homes here in Rhode Island, and we're one of the highest rates in the country. The standard is 37%, according to the AARP, and that national rate. And imagine us at 60% here in Rhode Island. Very, very sad. We know that structural racism has historically underpaid the nursing home workforce, which is 90% women and overwhelmingly people of color. And certainly it's time for us to address those inequities, and I believe that my legislation helps to do that in one small way. Often, in the last almost year, we've called these workers our heroes, and they truly are. But now it's time to set policy to show them that they really are the heroes that we call them, and this bill will address that. I want to also point out that the nursing home industry, and you're going to hear a lot from them coming up, I see the list of who's asked to testify, has received close to $60 million in additional funding since April 1st of this current year. It includes a 10% Medicaid increase and hazardous pay at approximately $26 million in direct payment from the feds, no strings attached. And collectively, these funds have covered most of the increased PPE and cleaning supplies that were necessary. So that's $60 million. $26 million in direct cash from the feds on May 22nd represents twice the annual amount that the nursing homes pursue every year in our budget. So if you ask me, that's a pretty good windfall. And the nursing home industry has made a profit. They have nearly $241 million in the last 2 years, according to the reports that they themselves submitted. Fleming Research Polls had done a poll back in the spring about this particular legislation and asking the Rhode Island public if 4.1 hours staffing standards would be something that the public would be interested in. They had an 82% approval rating across the state. So we know that Rhode Islanders want this legislation. The CDC has affirmed for years that infection rates go up in nursing homes that are poorly staffed. I don't think we need the CDC to tell us that. Most of us can already assume that. And we know that the nursing home industry has sent letters to us. I mean, we've been inundated to the General Assembly affirming that there has been year-long staffing problems in the nursing home. And that part is true. It has been ongoing. Let me just say, 4.1 hours, you wonder how we come to that particular number of hours, is set forth by federal standards. And really, it's time we start listening to experts on this matter when it comes to this. The industry itself has received state funding increases in our budget for the last 5 years. So the nursing home industry does receive plenty of compensation from our budget. You'll also hear from the nursing home industry that this bill will put them out of business. I suggest to you, absolutely not. It won't. I mean, if any nursing homes go out of business, it will not be because of this legislation. It will be because of their poor standards and their poor practices. As a matter of fact, a nursing home in North Providence just sold for $20 million. I also want to say that the data that the nursing home industry provided for us over the summer, I guess recently, they provide a lot of data themselves, the nursing home industry, and that has been refuted. They were using data from the year 2013. It's time we ask them to make that data more up to date. Ladies and gentlemen, I just want to say, with 60% of the COVID-related deaths here in our state, it's one of the worst in the whole country. We should be embarrassed by it. And I don't think the nursing home industry should be boasting about their infection control with these kind of numbers. Ladies and gentlemen, this bill is essential to many, many caregivers, to families here in Rhode Island that have their loved ones here in facilities. I know, Mr. Chairman, that's the end of my basic testimony. There's many, many people that want to be heard on this. I also want to point to the committee's attention that the SEIU, the union here in Rhode Island that represents many of the workers, have provided little short video clips from some of their members. I really suggest that you take the time to watch them. I mean, it's really essential. It's very important. I'm here in the building, Mr. Chairman. I'm going to hop off for a minute and assign some bills to committee so that this committee can get going. We can hear all of our bills in a timely manner, and then I'll get right back and join for the rest of the committee. Thank you for hearing this bill, and thank you, members of the committee, for your time.
Senator Goodwin, can you stay on just for a minute to see if the members have any questions for you and then go and sign bills? Does that work?
No, I'm kidding. Of course I can.
Okay.
Sure.
Any questions for the sponsor from the members? Okay, now go work very hard.
I'll be right back.
Okay.
Bye. Thank you.
So before we get to people who have called in, I want to remind people to mute if they're not speaking. And if you have any feedback or echo or anything like that, turn down your computer volume. That way we can roll ahead smoothly. So with that, I think all the committee members have the written testimony that is very thick and comprehensive on this bill, and a lot of it is redundant to what we heard last year, both support and concern for the legislation. I will go on to who is scheduled for call-in, and the first person to testify that we're going to try to connect with is Scott Frazier. Scott, do you want to go ahead?
Thank you, Mr. Chairman, good members of the committee. Good afternoon. My name is Scott Frazier. I'm the president and CEO of the Rhode Island Healthcare Association. We represent 64 of the nursing homes in the state of Rhode Island. And while I have the utmost respect for Senator Goodwin, I have known the senator for quite a while, I must respectfully disagree with her on this issue because the Rhode Island Healthcare Association is opposed to Senate Bill 2. At the beginning of my testimony last year in opposition to this bill, I stated that this bill is about the future of nursing homes in Rhode Island. I stated that if this bill passes, nursing homes in the state would close, period. And since that time, even without this legislation passing, we have seen one home closed, several homes have been sold, and just this week it was announced that one more Rhode Island nursing home will be closing its doors within the next 60 days. The home that will be closing is a 5-star facility. They have no deficiencies. They successfully managed a COVID outbreak. Still, due to inadequate Medicaid reimbursements and the threat of staffing mandates, dozens of residents will be displaced and staff will be out of work. There's no way other homes can comply with the provisions of this bill and stay in business. It really is that simple. At a time when our homes have been pushed to the limit, caring for our residents, battling COVID-19, securing PPE wherever we could find it, working hard to provide the care and companionship for those who could not see their loved ones, working to keep the spirits of our residents up, it's unconscionable to think that there are some who want to prevent our homes from continuing to do this heroic work that our members do each and every day. I'll give you an overview, but you're going to hear from many of our members who will tell you firsthand how dangerous this bill is to the future care of our most frail and vulnerable fellow Rhode Islanders. Let's take a look at the facts. No other state has adopted this mandatory 4.1-hour standard. Rhode Island already ranks at the top of infection control and quality rankings in the country with our present level of care. Passage of the legislation would result in a huge financial burden to nursing homes at a time when many are on the financial edge. The standard of 4.1 hours, as I say, doesn't exist in any state. 25 states do not have any minimum staffing guidelines. For those with no minimum staffing, many follow the guidelines of Medicare and Medicaid services, which require staffing based on the health status of each resident. Of states that do have minimum staffing requirements, the average is 2.5 hours of direct care. The state of Massachusetts is adopting a mandatory staffing level of 3.58 hours in just a few weeks on February 1st. And this came about after months of hearings and discussion. Now, what's the major difference between what was enacted in Massachusetts and this legislation? The Massachusetts law provides $90 million in funding so homes can achieve the minimum hours required. Rhode Island nursing homes already provide at least 3.6 hours of direct care. Rhode Island's at the top of the charts in many national rankings. The most recent report from the U.S. Government Accountability Office ranks us number 1 in the nation for infection control. In a report released in 2019, the Office of Inspector General found we have the lowest number of inspection deficiencies of any state in the nation over a 4-year period. And in 2019, America's Health Senior Report ranked Rhode Island second in the country in overall quality. We're extremely successful in the care of our residents with our present staffing. Taking a look at other New England states, I know it's often said that Rhode Island is the only one without minimum staffing. That's not correct. In Connecticut, there's 1.9 hours minimum. New Hampshire has no minimum hours. Maine requires direct care on a resident ratio depending on what time of day it is, whether it's during the day, the evening, or overnight. And Vermont has 3 hours minimum. Other reasons to oppose this bill: staffing is not a one-size-fits-all situation. Residents with multiple medical needs require a higher level of staffing than residents, say, in a dementia unit. And it's best to schedule nurses and nursing assistants in the units where they're needed most, rather than spread equally throughout a home in order to meet an arbitrary mandate. Passage of this legislation would be very costly to nursing home operators. The American Healthcare Association completed a cost estimate just last month, actually this month, in January of this year, on the state's threat to impose an emergency staffing guideline of 3.8 hours. AHCA estimates that it would ultimately cost at least $75 million to eventually bring staffing up to this level. We've submitted that report as part of our testimony. And in that report, it states that 57 facilities in the state are currently below that 3.8-hour level. When COVID invades our nursing homes, we see staff choose to retire early or just plain quit out of fear of contracting the virus or bringing it home to loved ones. That AHCA report, which again you have in your packet of testimony, states that to meet this level, again, of only 3.8, it would require hiring more than 800 new staffers. Given that this legislation calls for staffing above 3.8, you can only imagine the estimates of the cost and number of employees are going to be that much higher. Where's the money going to come to pay for this additional staffing? 2/3 of our nursing home residents in Rhode Island are covered by Medicaid, and it's unreasonable to think that Medicaid rates are going to be raised by the necessary amount to cover these additional costs. This is an unfunded mandate. You'll hear from our opponents that nursing homes have plenty of money, that our owners have been making money hand over fist, and this simply is not true. Our opponents have cherry-picked certain numbers to try to support their case, and we urge you to look at the entire financial picture. That information is also submitted as part of our testimony. There are other dangers posed by this legislation. They include requiring any Medicaid rate increase to be only used for a select group of employees to pay for rate increases, or pay increases. It would prevent fair compensation for all employees who are not included in this group, and it would prevent a nursing home from using the pay increases to cover costs, say, for food, a new generator, or safety improvement. There are many serious penalties for not complying with some of this, but more importantly, let's remember this is about more than facts and figures. It's about people. It's about the residents we serve and care for every day. Closure of any nursing home means that our most vulnerable fellow Rhode Islanders and their families will be forced to find new living arrangements and 24-hour care for their loved ones. This is extremely unsettling for residents and very stressful for families. Closure of a nursing home also means employees lose their jobs. I urge you to please don't let that happen, and please reject Senate Bill number 2. Thank you.
Scott, before I open it up to questions for the committee, I do want to ask you to have the people that you have scheduled to call in who own nursing homes or manage nursing homes. It's a very long list, and I assume they all have similar concerns to what you just went through. And for the sake of not only being fair to those in the committee, but also fair to the public who's looking forward to hearing from people that testify on the other two bills on our agenda, that there not be redundancy to what you went through, or redundancy to somebody who's already spoken, in lieu of putting a time limit, which at any time I could, but it's not what I traditionally do. But if there could be a little self-discipline towards that, that would really, really help the hearing, not only of this bill, but the hearings of bills that are on our agenda after this one. So if you could help me with that, and now I'll open it to see if there are any questions from the committee for you.
Thank you, Mr. Chair. And yes, we have encouraged our members who will be testifying to please be brief, and knowing that there are a lot of folks willing to testify, and we would just like those who are on the front lines who deal with us every day to give you their personal impressions. So thank you for that.
Yes, are there any questions for the committee? Thank you, Scott. The next person for call-in is Jeff Roy from the Holiday Retirement Center. Mr. Roy?
Yes.
Go right ahead.
Hello. My name is Jeff Roy with the Holiday Retirement Home in Manville. I'd like to thank the chairman and members of the committee for letting us speak. First, I would like to say, as I did for the last meeting I spoke at, that the timing for this bill to be debated is awful. When we are dealing with an unprecedented pandemic and have a multitude of other things to worry about, and again, drop what we are doing to oppose this bill, that would be devastating to Rhode Island's elderly population. I was speaking with some colleagues and came up with a little slogan: don't vote if you don't visit. At the last committee meeting that we voiced our opinions about this bill, I extended an invitation for any of the voting members to come to my facility, and I would personally give them a tour and show them that it may be a skilled nursing facility, but to many of our residents, it's their home. I did not receive any requests to take me up on my offer. I know these are not opportune times, but how can you make an educated decision if you haven't actually seen how our residents are cared for? I think if you're going to vote on something that may probably put some facilities out of business, everyone should have an idea of how our and many other facilities operate. If staffing ratios were such a problem, why does Rhode Island consistently rank near the top of the list nationally for quality of care? Obviously, we are doing something right. Trying to fill voids in staffing we have now are nearly impossible. Increasing the staffing ratios will only make the problem worse. Not to make a joke, but where are these people going to come from? Thin air? We use different types of recruiting avenues. Indeed, ZipRecruiter, iHireNurses.com, Facebook, Valley Breeze, Craigslist, and even a sandwich board out at the street. And we were even holding our own CNA classes before the COVID outbreak. To recruit staff, data we get from ZipRecruiter show us currently that for every 4 open positions, there's only 1 nurse applying. Instead of adding another unfunded mandate, how about increasing funding for the Medicaid budget, allowing us to increase wages for our tireless heroes that take care of our aging population in the state? Again, I am in strong opposition of this bill. I think it would be devastating, have a devastating effect on the nursing homes in Rhode Island. I would like to thank the committee for allowing me to speak.
Any questions for Mr. Roy? Thank you very much.
Okay, thank you.
Next person we're going to try to call into is Mark Lutzel. I guess we weren't able to connect with him, so we're going to go to Melissa Gagnon. Melissa Gagnon from Charlesgate, go right ahead.
To the honorable members of the Senate, House, and Human Services Committee, good evening. My name is Melissa Gagnon, and I work at Charlesgate Nursing Center as the business office manager. I have the pleasure of being a part of the Charlesgate community for 17 years. Many of our residents and many of our co-workers have been here at Charlesgate for many years. We are like family. I am concerned about this bill and the effect it will have on our family. I'm not saying that having more staff is a negative thing, but I know that we all must live within budgets. To put something into law that we cannot pay for just does not make any sense. We have already taken hits because of COVID, which has affected census, created a negative stigma for nursing homes, as well as caused the struggle with getting staff, as people have made other career choices and have left healthcare. Beyond that is the effect on our residents. If our nursing home cannot survive, residents who have lived comfortably in these homes cared for by staff who have built relationships over years will be forced to move. They will have to adjust to new staff, new surroundings. Staff who have worked in the same place with the same residents will have to take new positions. Change is difficult for all, but especially for the frail or disabled nursing home residents. I am concerned about my co-workers across all disciplines and the way it will affect the residents if choices have to be made regarding staff because of budget concerns. Residents need therapeutic activity and entertainment. They need delicious meals, hospitality. They need the support of social service department, the services of all other hardworking staff who contribute to the residents' care and environment. We have faced budget cuts for years and have struggled to make ends meet, even prior to COVID. And again, we face this unfunded proposed bill. I oppose. Thank you always and for your time for listening to my testimony.
Any questions of the committee? Thank you. Next person we're going to try to connect with for their telephonic testimony is Akshay Talwar from Briarcliff. Mr. Talwar,
Yes,
welcome. Go right ahead.
thank you. Chairman Miller, members of the Senate Health and Human Services Committee, thank you for giving me the opportunity to speak. My name is Akshay Talwar. I'm the owner-administrator of Briarcliff Manor in Johnston, Rhode Island. I just want to express to you my deep distress at this legislation. I have to tell you, this legislation just feels like a dagger that is being driven through my heart. I've spent 30 years of my life nurturing this facility like a baby. And now, right now, it just feels like somebody is taking a dagger and cutting this baby in half. Why? Why? What is the purpose? Why is this happening? This legislation has $75 million in unfunded mandates, punitive penalties, punitive administrative burdens. What is the problem that we are trying to solve? Rhode Island ranks number 2 in the country in quality, ranks number 1 in infection control. If you go to the federal government website, CMS Nursing Home Compare, and take a look at the data published data by the federal government. Put it in an array. Rhode Island ranks number 11 in staffing. Those are real numbers. Those are not cherry-picked numbers designed to make a point. I know in the past when we have come to the legislature and asked for funding, we are told you guys always cry wolf, you're going to close, and you never do. Well, let me tell you, let me give you a little bit of history. When I came to this industry, there were 110 nursing homes. There's 79 today. This week, Woodpecker in Green, Rhode Island closed its doors. The employees are going to go away. The residents are going to be moved into different facilities. Last year, Hallworth House on North Main Street closed. Wingate on the Boulevard closed its nursing home portion. Emerald Bay in Cumberland closed its nursing home component. Just from memory, Nancy Ann, Woodland, Rosewood Manor, Summit Nursing Home, Charlesgate went from 200 beds to 120 beds. Patuxent Nursing and Rehab off Post Road in Warwick. The empty building is sitting there like a carcass today. Edmund Place, Parkview, Cardi's. I urge you to don't think that places are not going to close. The end has started. Places are closing. And then I turn and ask myself, am I living in an alternative universe? In the middle of this pandemic, we need this additional grief in the middle of what we are trying to do. I'm going to tell you myself, I tested positive for COVID last year. I wear it as a badge of honor. My colleagues in this industry, many administrators, many owners, many directors of nursing, we have all tested positive and worked our way through it. We are gasping, we are breathing, we are looking for air. And in the middle of this, we are being told we are going to have this added burden put on us. I don't understand it. This is not going to improve quality. It is going to destroy access to care. It is going to close nursing homes. It has started doing that. And if that's the policy we want, if that's what the policy is, then why don't we just say so and fund some other mechanism of care? I ask you, I appeal to you, please don't do it. Please don't do this to Rhode Islanders. Please don't do it to the elderly of our state. Thank you.
Any questions for Mr. Talwar from the committee? If not, I want to thank you for your testimony, and we'll move on to the next person, and I will remind those who are still waiting to testify that if you've heard something that is in the frame of what you were anticipating to give us as testimony and it's already been said, make your comments as brief as possible, and we'll understand that they are similar to those who have already testified. With that, Kathy Donnelly from South County Nursing and Rehab.
Testify that heard something that is in the frame of what you were anticipating to give us a testimony, and it's already been said. Make comments that keep responsible, and we'll understand that they are similar to those who have already testified. With that, Kathy Donnelly from South County Nursing and Rehab.
Kathy,
Yes.
go right ahead. And turn down, could you turn down your computer that's broadcasting and just leave your telephone voice on?
Okay, let me just lower this down.
Yeah.
And I'll put my phone on speaker. Thank you.
Yeah. Thank you.
Do I go ahead?
Go ahead.
Okay.
I would like to thank the members of the Senate Health and Human Service Committee for allowing me to speak today. My name is Kathy Donnelly, and I'm the administrator of South County Nursing and Rehabilitation Center. I have worked in the nursing home industry for close to 30 years. In those years, I have found many colleagues that I worked with, like myself, go up and face their careers in the nursing home industry, from CNAs to nurses to administrators. I don't see folks any longer making the nursing home their career path. If you look on Indeed, you see many nursing homes have ads that are asking for staff, looking for staff. It is a struggle every day for nursing homes to bring in staff into a situation of a pandemic that we have right now. I've seen many changes throughout the years, but none as impactful that has occurred without funding and UHIP to now the pandemic. I too had COVID along with my staff, and I lost my father in one of the wonderful nursing homes in my hometown to COVID. South County and all the nursing homes across the state are home for many of our elders. They reside in our community. They know all of us. They may even know some of you. To them, their home means the same as our home means to all of us. They not only look to us for their survival, they place their trust in us to care for their homes. The staffing legislation currently before you would place a huge burden to the already ongoing struggles the nursing homes are facing today, meeting operational expenses and attracting staff to our facilities. We need your support to survive. This bill will not help our nursing homes to survive. For many, it will be a devastating effect and a huge burden. I respectfully request that you consider the struggles of all our nursing homes at this current time and reject this bill in front of you. Thank you.
Any questions for the committee?
No.
Thank you. Next, we have Nick Lutzel from Summit Commons. Nick?
Yes.
Go right ahead. And there are several, there are about 20 other people representing nursing homes to speak after you, so if you could keep your comments as brief as is reasonably possible, that would be helpful.
All right. Will do. Thank you so much. Hello, my name is Nicholas Lutzel, and I've been a nursing home administrator for the past 7 years. Since the COVID-19 outbreak, I've spoken to many families, residents, and staff about their sadness and struggles with not being able to see their loved ones, or about the fears of their loved ones catching this virus. Every one of these conversations breaks my heart, but every decision I've made since the outbreak has been with one thing in mind, and that's trying to keep my residents safe. This bill we're discussing today does not keep my residents safe. This bill will destroy nursing homes in the state of Rhode Island. It will close homes down, take beds away from the people that need them, and put people out of work. When homes close and get consolidated because of this bill, all non-direct caregivers will suffer. Housekeepers, kitchen staff, activity staff, office staff, rehab specialists, maintenance workers, they'll all lose their jobs. Nursing homes are already highly regulated, and continuing to pile on regulations is not the answer. This bill sets an impossible bar to reach and then has punishing consequences for not reaching them. The punishment is that a building must pay 200% of the money it would have paid to the missing staff in wages and benefits. And that's for the first offense, and it goes up from there. This is problematic for two reasons. First, any rational business owner, when given the option of paying staff to work or paying twice as much to not have staff do the work, would always hire more staff. So if 50 60, 75, or 100% of homes end up missing the criteria? Is it because we're all bad at business, or is it because the task at hand is just not possible? Second, there's a 3-strike rule. After 3 strikes, we lose Medicaid funding. Medicaid funds almost 70% of the beds in Rhode Island. Losing Medicaid funding is the same as shutting our doors. We already receive inspections from state surveyors annually to ensure we meet already existing federal staffing regulations. And if a home is found to not meet that requirement, they're required to submit a plan of correction to the Department of Health. Rhode Island nursing homes have, on average, a quarter of the deficiencies that Massachusetts and Connecticut have. We are not doing a bad job. But if you think the nursing home industry needs help, you're right. We're still experiencing fallout from the UHIP disaster, which is causing massive delays in Medicaid payments on top of the Medicaid cuts that keep happening. As I said, Medicaid is a huge percentage of revenue for nursing homes. Let's be the state that comes out of this pandemic holding our nursing homes high, saying, this is our plan to continue to support our nursing homes. Let's not be the state that says, we're going to punish our nursing homes out of business to try and increase quality. Thank you for the time. I hope this is the start of a bigger conversation about working together to improve nursing homes throughout the state of Rhode Island. Thank you.
Any questions for Mr. Lutzel? Thank you. Next, we'll try to connect with Kelly Arnold from Health Concepts. Kelly?
Yes.
Go right ahead.
Hi, my name is Kelly Arnold, and I want to thank you for your time today. I'm the Chief Operating Officer of Health Concepts, a privately owned nursing home management group that has had nursing facilities here in Rhode Island for over 55 years. I am that facility that was forced to close this week, and I just wanted to stress how hard that is on our residents, our staff, our families, and everyone else in this industry. This unfunded mandate is only part of the reason that we were worried about what we were going to do in terms of finances. The Medicaid funding in this state has been a problem for the last 12 years and only getting worse. Another unfunded mandate is not the answer. I'm here testifying today to stress how much we need your help. For the past several years, we've been beyond underfunded, and unfortunately, we just can't seem to get that point across. We rely on the Medicaid system for over 2/3 of our population. These people are our frail, elderly residents of Rhode Island who need to be cared for in our setting. They cannot be cared for at home. They need the nursing homes to live and thrive and be cared for. The residents are the ones that need your help, not the owners, not the administrators, not the staff. It's the residents of this state that need your help. I urge you to please, please vote against this bill. Thank you.
Any questions? Thank you very much. Next, we'll try to connect with Jennifer Campbell from Westerly Health Center.
Not the administrators, not the staff. It's the residents of this state that need your help.
Jennifer, could you please turn down your feed from the broadcast and leave your phone up and your broadcast down? Go ahead.
Yep.
Thank you.
Okay.
Go right ahead.
Okay. Good evening. Thank you, honorable members of the Health and Human Service Committee. My name is Jennifer Campbell, and I'm the administrator at Westerly Health Center. I've been in long-term care for over 25 years, and this is truly a crucial time for all of our residents and workforce. It may be in a quiet corner of the state down here in Westerly, but we too are very concerned about this bill. Simply said, it is a wolf in sheep's clothing. Increased staffing sounds wonderful. We would all love to have that, but it is impossible the way this bill is written. It's not simply about money, it's about people. Where do you expect us to find the caregivers to fill this mandate? So that will leave us with penalties for noncompliance. The goal here truly seems to be a desire to close facilities. The homes that our elders are so comfortable in and are getting great quality care and really being cared for by the heroes that have gone through this pandemic all along. I oppose this bill, and I urge you to as well, so that we do not continue to hurt our elders and our workforce in the state of Rhode Island. Thank you.
Any questions for Ms. Campbell? Thank you. The next person we'll try to connect with is Sonia Languas. Sonia,
Yes.
could you please turn down your broadcast feed and leave your phone up? Thank you.
Yeah, thank you.
And I'm sorry if I mispronounced your name, but go right ahead and make sure you understand that you have several people representing the similar facilities that are going to go after you, and we're trying to get through them all so as quick as your testimony can be, to make a point that is other than what we've already heard would be considerate to them. Thank you.
Okay.
Go right ahead.
Hi, my name is Sonia. I work at Riverview Nursing Home, and I'm the scheduler. I've been doing this job in Rhode Island, Mass. for various homes for over 22 years, and I'm also a CNA. So I can see all perspectives here, and in fact, my mom actually lives here, and I also have a daughter that works in the nursing home field. I am against mandatory 4.1 staffing. It is unreasonable. If you want a minimum, we should make it something reasonable. Then that's just not reasonable. Pre-COVID, we had a difficult time hiring for low pay. We actually boosted our rates, and they're pretty high for Rhode Island, which is, it's nice that we have to be able to do that. But Rhode Island also, we have to have an RN at all times in the building, which is it helps us also in many different ways. The barrier post-COVID is we have a screening process now that we have to make sure that everything is okay, and then we have to have everything, whatever we have to do for the screening process. Then people are ill during shifts, they get sick, I have to send them home, and then we have to wait 10 days. If they are positive, we have to have a negative before they come back. Also, daycares are closed due to COVID, so it's hard to get CNAs to come in, or nurses also, because they don't have anybody to watch their children. We have to wait for outside results when when they do feel sick, so we have delays there. And COVID, you have a 10-day or more for them to be out. The agencies, you need to pay double in order to even get somebody here, and you have to boost their rate in order for them to come in. It's just, we have mandatory lock-ins, which then CNAs and nurses get angry and they don't want to come back because we have to lock people in due to other people not being here. So we need to really look at this bill because it should not pass. Thank you.
Any questions? Thank you. Next we'll try Sean Coinoyer from Friendly Home. Sean.
Yes.
Welcome to the committee.
Hi.
Go right ahead.
Oh, okay. I'm sorry about that. Good afternoon, and I'd like to thank the committee for allowing me this opportunity to address the staffing bill before us in the state of Rhode Island. And I just wanted to introduce myself. I'm Sean Coinoyer. I'm the administrator at the Friendly Home up here in Woonsocket, Rhode Island, and I'm a third-generation nursing home operator. Friendly Home was started in, I think it was roughly 1958 by my grandmother, who was a nurse, and my mother and then myself have carried on the mission in this state of caring for our frail elderly residents and family members in our community. I'm really quite dismayed by this 4.1 staffing bill. I don't feel that this is an answer to supposed issues in our industry. We have seen many things over the 50-some-odd years that we've been in business, and this is one of the most daunting pieces of legislation that we've ever had come before us. We have been continuously, chronically, and embarrassingly underfunded in the Medicaid system in this state for approximately, 12 to 15 years. We always seem to be on the chopping block, but yet we always seem to also have our necks on the chopping block. And this 4.1 staffing mandate, while it sounds wonderful in theory, is completely unnecessary in addition to being completely unfunded by the Medicaid system that we have in Rhode Island right now. We would love to hire more people. Those people are not in existence. We have competition from many other industries now, vying for the people that might fill those wonderful roles in our facilities, not just nurses and CNAs, but social workers, kitchen aides, activity people, social services. We have a myriad of positions that go into the 24-hour, day-to-day, 7-day-a-week caring for all of our residents in our nursing facilities. Compounded with the issues, as you've heard, of UHIP, which was an absolute strangulation on reimbursement for us, but yet we managed to somehow always rise to the occasion and, continue to operate under that horrible, horrible system that's still in effect today. And then on top of that, we are now facing a absolute 100-year pandemic of proportions that no one, in at least my lifetime, has ever seen before, never mind tried to operate our nursing facilities with this absolute insidious, vile, silent infection that is raging, not just in Rhode Island, I might add, but yes, in the entire world. So I just wanted to advocate for my residents that what we need is we need to have some respect for the care that we give our residents and our nursing facilities, and through that respect comes adequate funding to care for these people who have worked, most of them, their entire lives in this state and paid taxes into the system to helpfully have come back and help pay for their care in their golden years and not have to constantly be worried that potentially the place that they call home and the people that they now call their family, all their caregivers, might not be in existence in the very near future due to this absolutely crushing, unfunded mandate that does nothing to solve the real issue that we have going on. And that's about all I have to say on that. And I thank you for your time.
Any questions for Sean? Thank you. Next, we'll try to connect with Trevor Kinney from Genesis Healthcare. Trevor?
Yes.
Go right ahead.
All right, thank you. Good evening. My name is Trevor Kinney, and I'm the Regional Vice President of Operations for Genesis Healthcare. We currently operate 7 skilled nursing facilities in Rhode Island. I'm testifying in of Senate Bill 2. And I say currently operate 7, because Genesis, before this year, had 9 facilities in Rhode Island. And we've operated in Rhode Island for more than 20 years. And we're very proud of our quality of our facilities in Rhode Island. But this last year, we sold 2 of the nursing homes that we've operated because of underfunding and the possibility of this mandating staffing bill. As an operator in Rhode Island, year after year, we are faced with many difficult decisions around cuts in our facilities due to lack of funding. And this bill is is no different. I do not oppose more staff. We need more quality staff in our state. Like other operators, we work to partner with our local schools, training programs, and we host even our own free CNA training programs where we pay people to come in and we pay them while we teach them how to be a CNA. But there are no people out there. Many of our classes are half full. We need to focus on getting more people, but properly paying the hard individuals we have now, too. Our Medicaid reimbursement has been cut by millions by the state since 2012. With the restoration of these funds, nursing homes will be able to adequately care for residents and pay our workers, our heroes, accurate wages, not mandatory hours. That's not going to solve the issues. Passing such legislation as this would put our organization in a position where we would have to make difficult decisions around cuts and thinking of actually even operating in Rhode Island. This puts critical to the care of our residents. When this bill says that any future increases have to go for staffing, how are we going to pay for increases in food, therapeutic activities, and quality of supplies, not to mention staffing in non-direct care areas? Please take time to review the information that we've sent you and look at this and understand that this bill will close facilities. Thank you.
Mr. Kinney, I have one question for you. Genesis, does that operate in other states as well as Rhode Island?
Yes, it does.
And you sold 2 facilities. Are those facilities sold to people who are operating as nursing homes still?
Yes, they are. Yes.
Okay. And is that part of your overall business model, and including in other states, that you do sell facilities
Yes.
to other operators? Yep.
Yes. Yeah. A lot of times in states where the Medicaid funding isn't adequate to be able to provide quality of care, we definitely look at opportunities to leave those states.
Okay, but my point is you haven't left the state. You sold, I assume you sold it at the price that you were pursuing, and you're still operating in the state, just you've decided to take the revenue from the sale rather than the revenue from operation.
Well, many of our facilities, we look at, we don't typically sell them all at once. So
right, you sold 2 out of 7. Yeah,
2 out of 9. 2 out of 9.
Okay, thank you.
Yep.
Any other questions? Next, we'll try to connect with Michael McMahon from Brentwood. Michael?
Yes.
Go right ahead.
Thank you, Mr. Chairman and members of the committee. My name is Michael McMahon, and I am here to testify against Senate Bill 2. I started working at Brentwood Nursing Home in 1987 when I was 14 years old. I worked in dietary and maintenance through high school and college. Upon graduation from college in 1994, I began working in administration. My sister is the director of nursing. She began working at Brentwood in 1985 as a dietary aide. She went on to become a CNA, went to nursing school, became a floor nurse, and is now the director of nursing for almost 20 years. Each of us has had and currently have children who work in various capacities at Brentwood, positions in dietary, maintenance, and nursing. There's not a job or a task that either of us has not completed ourselves. We know firsthand what is necessary to meet our residents' needs. Working at Brentwood is not just what we do, it's a part of who we are. The people we work with are not just our colleagues, but our close friends. And the residents we care for are what binds us all together. This legislation does not benefit any of these people who I care deeply about. While it may be well-intentioned, it will be a disaster for Brentwood and the entire industry. We will not survive under this one-size-fits-all mandate. What we have given our lives to will be gone in a matter of months. We are a facility that provides post-acute hospital rehab. As a result, we need additional therapy staff to assist the residents in building up their strength, and social workers to coordinate community support so that safe transitions can be made home. Other places have dementia units and need more activity staff and engage residents rather than registered nurses who manage clinically complex issues. If you have a behavioral health unit, your staffing needs would vary greatly from these 2 units. It's not a one-size-fits-all situation. In addition to these differences, some places they use a universal worker model where CNAs take care of all of the residents' needs for the day, including food, laundry, housekeeping, while other facilities have large staff in laundry, housekeeping, dietary, and have the CNA focus on personal care of residents. Each model works, but the CNA staffing requirement for each would be significantly different. There are many more variables that need to be taken into consideration that this cannot possibly account for. Resident acuity, staff experience, facility layout. These all directly affect the resident staffing needs. Please do not pass this bill. Thank you for your time.
Are there any questions from Michael? If not, before we get to Gary Sklar from Geriatric Medical, I'm going to ask, this is not going quite as, even though people are being very brief, it's still quite redundant to the people we've already heard from. And I do see a few people on here that are calling from the same facility as we've already heard from, such as we have people lined up to talk from Holiday Retirement Center in Charlesgate. And so I'm going to ask people to reference other testimony and just say they agree and have similar opposition rather than going into what they've prepared written to make this go a little faster, seeing as we know you represent nursing home facilities, and we're trying to move along not only to other people who want to testify on this bill with different perspectives, but also to the other bills that we plan to hear tonight. So I want to pick up the pace based on some redundancy we are noticing that I specifically requested we try to alleviate. With that encouragement to go in a different way, I'm going to next go, is it Gary Sklar next? Yep. Gary?
Yes.
Go right ahead.
Okay. To the honorable members of the Senate Health and Human Services Committee.
Gary?
Yes.
Did you hear?
Yes.
Did you hear what I just went through in trying to get the pace picked up here? To not read from your written notes, to acknowledge the testimony of previous people if yours is similar, and to paraphrase anything that might be unique to your testimony, so we can get to the several other people that we're trying to get to, not only on this bill but other bills.
Okay. Mine is, I think mine's a little unique, so I'm going to go from what I have.
Okay.
Okay. To the honorable members of the Senate Health and Human Services Committee, my name is Gary Sklar. I'm the Director of Business Development for Geriatric Medical. We're a third-generation family business located in Woburn, Mass., serving all of New England with a long history here in Rhode Island. Thank you for your service, and thank you for the opportunity to testify in strong opposition to the proposed 4.1-hour mandatory staffing legislation enacted relating to the health and safety of nursing home staffing and Quality Care Act. If enacted, the staffing legislation will negatively impact thousands of nursing home residents, thousands of dedicated frontline workers, and hundreds of adjacent businesses. Nursing homes will close, fragile seniors will lose critical care, families will be displaced, and thousands of hardworking families will be torn apart forever. Long-term care is a vital industry. It is a chosen profession. Often a thankless job, underfunded, underpaid, mentally and physically challenging. On average, 70% of nursing home residents is Medicaid. Yet the state continues to impose additional mandates and financial burdens on businesses and wonderful people that are dedicated to providing quality care to our seniors. As an industry leader, I felt that legislators needed to hear a different perspective. The issues are not limited to just the nursing homes and its parts. There will be collateral damage beyond the nursing home. There's a lot at stake here. I'm here to testify from a vendor's viewpoint, as a vendor that cares deeply about what happens to our industry, our community, and the people we serve. Geriatric Medical delivers crucial supplies and equipment to nursing homes throughout Rhode Island. We began in 1945 when the war ended, and we've been celebrating 75 years in business. 75 years as an employer creating jobs, 75 years doing what it takes to make sure that every person in the nursing home gets the medical supplies they need when they need them. The crisis we're experiencing today has extended far beyond every nursing home. The COVID-19 pandemic has been unprecedented and a blow to an already broken and enormously undervalued industry. The massive underfunding we are faced with impacts much more than just every nursing home resident. It affects every family member, every nursing home operator, every employee, and anyone that touches a nursing home. And if you're doing business with a nursing home like me, the vendor, or any other outside vendor, the situation could be catastrophic. A domino effect of impacting thousands of lives, stretching far beyond the walls of any nursing home. My company provides important supplies, and during the pandemic, critical PPE to nursing homes in Rhode Island. Vendors like me are feeling the pressure. The financial burden put on vendors is being pushed way too far. The proposed legislation will put financial impact for many vendors at the edge of a cliff. Some have gone over the cliff. In aggregate, the amount owed by nursing facilities to vendors has increased by more than 40% over the past 5 years. This is an unsustainable trend that can lead to financial credit hold, eventual vendor closure, resulting in even more disruption, despair for nursing homes and its frail residents. Yet we, as vendors, still have an overwhelming sense of moral obligation to respond. We want to help, and somebody has to step up. We know when a facility calls us, they need supplies. But what are we supposed to do? Our seniors shouldn't have to worry. They shouldn't have to pay the ultimate price. Don't we owe it to them to pay it forward, to make sure that they have a place to live that's safe, where they can be cared for, and they're not alone? We can't sweep it under the rug. The problem isn't going to go away. It's not going to vanish into thin air. It's a real crisis. It's much bigger with much greater unintended consequences. Please reconsider. Thank you.
Any questions? So I'm going to make a slight edit to this list. We not only heard from Scott Frazier, who represents all the nursing homes that we seem to be hearing from, but we've also already heard from somebody representing the Holiday Retirement Center, Charlesgate, and Riverview Healthcare Community, which have people who are signed up again to testify. I'm going to skip over them, and they can submit their written testimony. So at least we could take a few off to give more time for other people, not only on this bill, but our other bills that we're obligated to consider tonight. So that would be Greg Chapurian, Fran Davenport, and Tony Mare. Please submit your written testimony. We've already heard from who you're calling in and representing. Richard Desolets. Richard from the Warrant Center?
Yes.
Go right ahead and be as brief as possible and reference previous testimony if you can.
All right. Thank you very much. I appreciate the time. My name is Richard Desolitz. I'm the administrator of the Warrant Center in Warren, Rhode Island. Been an administrator in this state since 1973, so I have seen the industry grow. My biggest concern about this, and I'll make it very brief, is that I see a potential wage war that's going to occur in the event that this bill gets passed, because it's going to be the haves who are going to be able to pay the limited number of staff that are available and lure them away from the homes that are struggling. This is going to create a real problem going forward for the homes that have really had a difficult time getting through the pandemic as it is. So for that reason, and many others as well, I would ask that you not vote for this bill. Thank you.
Thank you. Next we have Katrina Woodward from SDX Dysphagia.
It's going to occur in the event that this
Katrina, could you turn down your broadcast and leave up your phone, please?
Yes, sir. How's that?
That's better. Thank you.
Thank you.
And please reference previous testimony whenever possible so we can get through this very long list.
Yes, sir.
Go right ahead.
Thank you. My name is Katrina Woodward, and for the past 18 years, I have operated a mobile fiber optic endoscopic swallow testing business that travels across New England. I want to express my specific concerns for Senate Bill number 2, and I believe as a speech-language pathologist, I do have a very specific perspective to present tonight. I have seen the devastating impact of COVID on our rehab workforce across the state. Therapists are continuously losing hours, benefits, and suffering wage decreases at a time when healthcare costs are at a premium. In the past week alone, I can identify several speech-language pathology, occupational, and physical therapy colleagues in Rhode Island alone that are suddenly facing wage decreases of 4 to 10%. These same rehabilitation therapists have walked into COVID-positive facilities day after day to do their jobs at risk to themselves, at risk to their families, and have not asked for anything in return. As a consequence of the ongoing difficulties and the ongoing uncertainties, many speech-language pathologists in particular are relocating to steadier school-based positions, leaving our nursing homes exposed. We are losing experts that can represent the therapy and rehabilitation piece, which
is half of what we do in post-acute care. There are two important parts to the post-acute care continuum: skilled nursing and rehabilitation. And I truly fear that unfunded staffing mandates for our skilled nursing facilities are only going to increase the difficulty in retaining experienced staff. Requiring pay for more nursing and nursing assistant hours will certainly force reductions in other departments. This defunding is a huge concern for your rehabilitation experts in the areas of speech, language, occupational, and physical therapy. Our aging population definitely deserves access to quality nursing. And the other piece of that post-acute care, and I just can't reinforce it enough, is the rehabilitation. Please preserve our skilled nursing and rehab by addressing the complete picture of the skilled nursing facilities as you consider Senate Bill 2. I respectfully thank all of you, Senator Goodwin, you as well, for your time and for your consideration. Thank you.
Any question from the committee? Thank you very much. Jennifer Ramagnolo from Village House. Jennifer?
Yes.
Go right ahead.
Okay, thank you. Hi everybody. My name is Jennifer, and I am the administrator of Village House Nursing and Rehabilitation. We are located in Newport, Rhode Island. So to the honorable members of the Senate Health and Human Service Committee, I have worked at Village House for 9 years, but I've been within the long-term care industry for 20. We employ about 100 people, most of whom live right here on Aquidneck Island. We have about 75 residents on average, most of whom have resided not only on Aquidneck Island their whole lives, but right here in the 5th Ward of Newport. For those of you who are not familiar with the island life, and I use air quotes on that, we think driving from Newport to Portsmouth requires for us to pack a lunch. Village House has been a staple on Harrison Avenue for 45 years. And without our services, the people of Newport would have a difficult time surviving. This staffing legislation, known as the Nursing Home Staffing and Quality Care Act, would cripple us more than we've already been crippled this year.
Hey, Jennifer, I don't mean to interrupt you, but in deference to trying to make time for everybody who's scheduled to testify tonight on this and other bills, I'm going to ask people who we haven't called yet, who we will call, to abandon their written testimony and to reference previous testimony, and that their sentiments are similar. We do want to hear anything unique, but other than and about your facility. But I'm just trying to pick up the pace on this. Of all those who are going to call, if we could have some cooperation, that would be great.
Okay, so you're talking about the testimony I've already told to the House back in the summer?
Anything that you've written, we wish you would paraphrase and reference previous speakers that the points you agree with on this legislation. That would be great. We do have written testimony already submitted.
Oh, okay. Okay, well, I'm just really here to say that I am in disagreement of this legislation and that it's going to cripple the nursing home industry. There'll be lots of nursing homes that will close because of the unfunded mandate of the legislation. So I just wanted to say that I am not in favor of it, and I really implore all of you to not pass this law. I know the words in the bill sounds great, but it's going to cripple Village House and many other homes, and it's going to take access away to all my residents who desperately need and deserve us. So thank you very much for your time.
Thank you.
Okay, bye-bye.
Bye. Next we have Stella Moran from Kent Regency. Stella?
Hello? Hello?
Yes, go right ahead.
Hi, my name is Mary Beth Lesko. I'm the Director of Nurses and RN, as well as second-generation owner of Grace Barker Health in Warren, Rhode Island. And in the interest of brevity, I do oppose Senate Bill number 2, particularly for the workforce development piece. I established the curriculum for our Cna Training Program that we've been running pretty much consistently since 1994, and I can attest that it is extremely difficult to recruit and retain appropriate CNA staff. So not only is this bill just incredibly devastating, but it is an impossible bar. We consistently run a free CNA class. We advertise in Indeed and in various other venues. We have reached out to other instructors and other programs, American safety programs in Cranston, that provide CNAs, and the workforce is not there. So please do not pass this. As the second-generation American to my dad, who immigrated from the Azores, my parents built this business from the ground up. It is my life's work, and my husband as well, who unfortunately did not get to speak tonight, Mark Lescalt, who is the administrator of Grace Barker, and our son, who is the assistant administrator now. This bill is devastating to our industry and to our life's work. Please do not pass it. Thank you.
Any questions of the committee? Thank you very much. Next we have Liz DeRosa from West Shore Health Center that we're going to try to connect to. Liz?
Yes.
Go right ahead.
Hi, my name is Liz DeRosa. I'm the administrator at West Shore Health Center. I will be in Warwick. I'll be very brief. I just think that now is possibly the worst time to do this to our residents and most importantly our staff. I'm from a home where we got hit very hard in the beginning of this pandemic, and both residents and staff, unfortunately, we lost a lot of residents, and our staff has been beside themselves thinking, are we going to lose our job because the census is so down and so forth. So it's not extra bodies that we need. We don't have the funding for this, but staffing was a problem prior to this pandemic. And trust me when I tell you, there's not people lining up right now to work for nursing homes because of COVID and because of all the negative attention to nursing homes right now. So this is not the time to do this for them. So much for healthcare heroes and everything that was said in the beginning. What happens now? We can't afford this. We couldn't afford this prior. This will cripple nursing homes. It'll close nursing homes, and people will be out of work. Thank you.
Any questions? Thank you. Next, we'll try to connect with Susan Lehman from Grandview Nursing Center. Susan?
Yes, hi.
Thank you.
My name is Susan Lehman. I'm the administrator at Grandview Center in Cumberland. And regarding what you have just said, I just wanted to agree with everyone who has gone before me, and I oppose this bill, and I thank you for your time tonight.
Thank you for calling in. Any questions? Thank you very much. Peter Pizzelli from Woonsocket Health is the next person we'll try to connect with. Peter?
Yes, I'm here.
Go right ahead.
Okay, thank you. Thank you, Mr. Chairman and the members of the committee. My name is Peter Pizzelli. I'm the administrator at Woonsocket Health and Rehab in Woonsocket. We're a family-owned business. My family also owns Golden Crest Nursing Center in North Providence. We've been in the business for nearly 60 years, and I concur with all my colleagues today who have expressed their dismay and their fear about this bill that you're considering. So please believe me and them when we tell you that the bill before you, however well-intentioned, is a recipe for disaster. I would just like to say, with all due respect, the $240 million of profit that was quoted earlier, I think if that were anywhere near true, most of us would not have endured this nightmare that we had to live through this past year and have long since retired. I think there's a lot of misperception about nursing homes, how we operate, and what our finances are. And last year, the Rhode Island House of Representatives proposed the formation of a committee to study our objections to this version of their version of this bill. And to my knowledge, that committee never convened, or if it did, its findings were never made public. So before it votes on this legislation, I urge the Senate to form a committee of its own to meet and listen to our industry representatives, to learn about our industry, the thousands of people who work in it, and the thousands of elderly that we serve. This bill could potentially hurt a lot of people, so please don't be in a rush to pass it. Thank you.
Any questions? Thank you very much for calling in. Next, we're going to Jason Traporton from Mansion Nursing Center.
Hello.
Jason, go right ahead.
Yes. Thank you, Chairperson, and members of the committee for allowing me to speak. My name is Jason Traporton, the Vice President of the Mansion Nursing and Rehabilitation Center. I just want to let you guys know that the Mansion was one of the last nursing homes in Rhode Island to be hit by COVID. Despite being in Central Falls, with the highest community spread in our state, we were COVID-free through Rhode Island's reopening. And we had our first spread this fall, which resolved in no loss of life or serious illness. So that's a caregiving outcome that I think tells you who we are. I want to respond directly to something Senator Miller brought up, and that might fill in the pieces. It's what's being dismissed is these transfers of nursing homes, and I think that needs to be directly addressed. They're going to people who have deeper pockets, and what they're betting on is when nursing homes fail, you folks will be compelled to act and restore funding. So there's no mystery to this, and those are institutional failures. When you lose people with their name over the door like me, small providers, even larger good actors, we've lost something. We're headed towards McElder care. And what they know, and what you are not considering, I think, clearly, is that there's a massive increase, as other people might have testified, there's a massive increase in demand coming. And people in the state of Rhode Island, when they figure out that nursing homes are failing, as they had in Massachusetts, in mass, because eventually they become terrible investments, so they fail in a bunch. What people will figure out in this state is that there's like a bait and switch from nursing homes to something else, and they're not going to accept a switch to home care. They're not going to go from 24/7 care to care every other day. And I fear that might be what's happening. But I want to address context, which this committee has not heard. This minimum staffing initiative started in 99 into 2001 through the Center for Medicaid and Medicare Services as a federal lift. A recent 2019 paper entitled Incentivizing Better Quality of Care, the Role of Medicaid and Competition in the Nursing Home Industry, in the American Economic Review contemplates as much as a 10% increase in federal Medicaid reimbursement rates. That's how much funding would be required to do this correctly. It's not a state lift. The supporters of the bill say that nursing homes have this heavy burden in front of them, and our caregivers need help. That's true. Nobody objects to improved staffing ratios in general. But what you're suggesting and what this bill does is to chop our leg off and graft the muscles of our leg to our arm to accomplish this lift. After which you expect us to keep moving and to produce quality care. This is a nursing home killer. We're not going to survive that operation. We can't transfer easily resources and have our standard of care survive. The chief national expert for minimum staffing in the country, Dr. Charlene Harrington, in relation to her 2007 paper, Nurse Staffing Levels and Medicaid Reimbursement Rates in Nursing Facilities in the Journal of Health Services Research, says it clearly. To increase staffing levels, average Medicaid reimbursement rates would need to be substantially increased. No credible authority would ever suggest piloting a new national standard without funding it. Nobody. This bill demands that nursing homes in the middle of the greatest healthcare crisis of our lifetimes pay for a new national labor standard. Why are we listening to this now? Nursing homes that have been effectively defunded for years and years, as you've heard, we've been crushed. And I want to put a face on this. For a local neighborhood nursing home that has 62 beds, what does that mean for us? We went into the pandemic missing $1 million from care. Our wages are always a proportion to that. That's 2/3 of every dollar that comes in goes out in the form of wages, right? So our employees' share of that missing funding is over $600,000. $100,000 or more is missing from building equipment supplies. In 2019, we had a 3% operating margin. To translate that for this committee, that's a rounding error. That's a rounding error. If this bill passes and we were to survive it, it's going to cost us almost $300,000 a year. And after zeroing out our income and freezing salaries, it's going to force us to tear $85,000 away from resident care. I mean, that is wild. This is a dagger in the back of elder care in Rhode Island, and you guys are seriously contemplating it. This is getting stamped. What the hell are we doing? A progressive leader I pleaded with to oppose this legislation felt I was objecting to how my fellow nursing home how nursing home administrators were being treated, or I was defending or apologizing for bad actors. I want to make this clear for people like myself. I have no solidarity with bad actors. My duty is first to our residents and their families, to our staff, and everybody else comes next. And to that point, to the point of our specific resident population, I want to show you how this goes horribly wrong in a facility like mine. We are in the low 3s for our current hour standard. We're below the state average significantly. Why? Because a significant proportion of our residents have geriatric mental health issues. They have dementia, Alzheimer's, and psychosis. So they can wash themselves, right? They can walk by themselves, they can feed themselves. But they need 24-hour care. And that explains the differential between us and other homes. And what does that mean when this bill is enacted? Your politics should never be part of this. What does it mean? This bill is going to put residents in my facility on the street. It's going to put people under bridges, right? That's real. So Central Falls, you have a lot of there's a lot of progressives who are behind this, and they're thinking this is great. It's simple. We're going to just give more help where it's needed. The help doesn't exist, and the funding doesn't exist. But that's what it's an easy talking point. And you guys don't have to stand up and raise the money to back it. You can spout ideals, and you don't have to back it up. Your politics should never be about taking from the vulnerable to give to the hardworking. And that's what this legislation will do. It should not have made it to this committee. This bill is going to force nursing homes to run as you dictate. Administrators and nursing home leadership is unanimous. You've heard them on this call in rejecting this legislation. We're the ones who are looking at the budgets. We're the ones who understand the big picture of how care is delivered and where those resources go. It's going to tie our hands and lock up our budgets. It's going to freeze the salaries of non-caregiving staff who have been risking their lives with us. Our maintenance people, our heads of housekeeping, our cooks, they're all in our buildings risking their lives. And this bill will make sure they never get another dime. If we can survive at all. If we survive, we can't afford to pay them more. The managers and leaders of our institutions are telling you, don't take this up. This is like engineers and pilots of a plane telling you, don't build the plane this way, it's going to crash. And you're saying with this bill, build the plane the way we're ordering you to build it. Okay. All right. Now we've done it. Pretend we've done it. Now we have this extra staff. We've done it and we've survived. We have this extra staff in our buildings, and now you're trusting us to direct them to produce better quality care. Does that not seem ironic or weird to you? This bill is saying to us, I don't trust what you're telling me about your resources. I don't trust, even though your expenses are going up through the roof, right? And your funding is going down. And we know that your funding, in your other sources of funding, private pay and skilled census, are going down. This bill is saying to us, hey, I don't trust what you're telling me, but I trust you to fly the plane. Would you get on that plane? It doesn't make any sense. I think the test of leadership is pushing back against bad ideas and finding the right tools to solve problems. And the politics of this are garbage. The people getting lost.
Jason?
The people, yes?
I have a question, and then I have to move on. Your testimony is valuable. I have one question I probably should have asked Scott earlier on. Can you give us an example of what kind of COVID funding you've received in the last, since March, about the last year?
Yes. I'm delighted that you asked that question. If it weren't for the federal government, we would be closed, right? And all 62 of our staff would be out, and our residents would have to be discharged to some other facilities. So thank you for asking. We have received PPP loans and HHS loans. Where has that money gone? It's a lot. Where has it gone? It's gone into our facilities. We have spent, let me pull this up. I just did this today, and I want to give you a sense of this because, you know, it's always esoteric until you talk about the details. We started to isolate zones in the building we needed to add a level of security. So we have to replace interior fire doors and external doors with mag locks. That cost $50,000. We needed a generator. This is before COVID, right? But it's for emergency situations, $50,000. We have to have 2 different ramps into our building. Those ramps, rebuilding that, and those ramps cost $30,000, $25,000. And please keep in mind, we're a 62-bed facility. It's capital intensive. We had to update our call system so we can see a history of the calls and supervise clinical responses across different new sectors in our building. Again, it's a part of a security measure. That costs $30,000. Beds and mattresses to meet new bed safety regulations, $23,000. We pay $30,000 or more every year in software expenses to manage and use the information generated by the care we deliver. And that is a very modest number, by the way. That's 3 to 4 times less expensive than the standard system, right? And to make up for that, we use all sorts of other technologies to make up for that and to keep those costs low. So we have been making cuts, folks.
So we don't have time to go into that kind of detail because we want to get to other people.
I'm just giving you an example.
I just want people to have an idea that there were several industries that luckily got COVID funding and that temporarily alleviated some of the issues. Yeah.
I don't know why you are saying luckily in the sense that we are at the center of this, right? Yes. And the missed opportunity here is we want, you know, what we have is a buffer, and what this legislation will do is cost us $269,000 a year in perpetuity. That money will be gone. If we have one more wave of COVID in 1 year, that money is gone. Whatever we have left that we haven't deployed in our building, which has been suffering for a decade of underfunding, will be gone. There is no money under the mattress. And by the way, I want to make this point. We're not a REIT. I don't have any special. We're an S Corp. We're very simply organized. We are a test case of why this doesn't work. We're a neighborhood nursing home, and we're a test case for why this legislation is busted. Because we don't have any fancy governance. We don't have investors from out of state. We're local. I live across the street. I can see our nursing home. Okay? And this is broken legislation. Thank you for your time.
Thank you for your testimony. Any questions from the committee? Thank you. Next, we're going to try to connect with Lisa Bouchard from Berkshire Place. Lisa?
Lindsay.
Lindsay, I'm sorry.
That's okay.
Yeah. Go right ahead.
Oh, hello. Good evening. Thank you, Chairman and members of the committee. My name is Lindsay Bouchard, and I am the Assistant Administrator at Berkshire Place in Providence, which is a family-owned and operated nursing home. I've been in there for about 8 years, and I've been in the industry for over 15. I have to agree with all my colleagues in the industry. Everybody's done a great job of testifying tonight, and I agree with them all 100%. I just wanted to remind you that week in and week out, we listen to Dr. Alexander Scott on the news stations, and, you know, herself has said that implementing this policy is nearly impossible. She said that a minimum staffing standards to be successful and implemented Sufficient data must be available to establish meaningful metrics around minimum staffing. There must be a sustained pool of nursing staff, for example, RNs, LPNs, and CNAs, in which to hire, and appropriate financing must be made available to support them. This policy is done with no input from our industry. There is no workforce out there right now for us to hire. I know that many people have talked about the ads in Indeed and the amounts of money that we've had to pay, and the agencies that we're paying double, triple the amount that we normally would. It's just almost impossible to sustain at the rate that we're going. So I just ask that you oppose this bill. I am not in favor of it, and I ask that you stand here and support the nursing homes and oppose it. Thank you for your time.
Thank you. Any questions? Thank you very much. Next, we'll try to connect with Garrett Sullivan from Heritage Hills Nursing Center. Garrett?
Hello?
Yes, go right ahead.
Hi. Thanks, Mr. Chairman, members of the Senate Health and Human Service Committee. Thanks for hearing my testimony this evening. Again, I will be brief. My comments and thoughts on Senate Bill number 2 mirror, everything that my colleagues have previously said, especially with the owner of the mansion. I wholeheartedly agree with everything that, will affect our nursing homes and our industry. I'm the administrator of Heritage Hills Nursing and Rehab Center, which is a 100-bed facility located in Smithfield, Rhode Island. The facility has successfully provided quality care for the residents of Smithfield and surrounding communities for over 46 years in an unmandated staffing time period. We employ over 120 dedicated, loyal, hardworking, compassionate caregivers who consistently provide high-quality care for the residents that we serve, long-term and over 200 short-term rehab admissions that we safely discharge to home annually. My main point is, within this industry that's already decimated by the effects of a pandemic, CARES Act, PPP funds running out, running low, facilities across the state barely scraping to get payroll together. With this financial burden that, is going to, put on our facilities to hire, train, and maintain, this level of direct care per patient hours. I really just wonder what the state's answer would be when my home and many others no longer exist to care for our aging population. I ask that you consider the honest facts and statements given by those of us tonight who truly want to do what's right for our residents, our staff, and the communities we serve, and vote no against Senate Bill number 2. Thank you.
Any questions for Garrett? Thank you. Next, we'll try to connect with Katie Norman from Grand Islander Center. Katie?
Yes?
Go right ahead.
All right, I promise to be brief. My name is Katie Norman, and I am the Vice President at the Rhode Island Healthcare Association, and I am testifying in opposition of Senate Bill 2. Though I currently work for the Rhode Island Healthcare Association, since 2009 until a few weeks ago, I have worked at Grand Islander Center, a 146-bed facility in Middletown that employs nearly 160 individuals. I am here at their request today to testify on their behalf. So as a resident of Rhode Island and a supporter of nursing homes and their quality care in this state, I wish I had the opportunity to provide my prepared written testimony, but in the essence of time at your request, I want to stress that quantity does not guarantee quality. And as Michael McMahon stated earlier, our businesses are not a one-size-fits-all. We care for people. Thank you for your time.
And thank you for skipping so much of what you prepared, and we'll make sure to look at your written testimony.
Great, thank you.
Any questions? Thank you. Next, we are going to try to connect with Tara Kuthan from John Clark Nursing and Retirement Center. Tara?
Hi.
Go right ahead.
Okay. Hi to the members of the Senate Health and Human Services Committee. My name is Tara Kuthan. I'm the Assistant Executive Director of the John Clark Retirement Center in Middletown, Rhode Island. I've had the pleasure of working here for almost 12 years. We employ roughly 70 employees, and we care for 60 residents who require 24/7 nursing care. We're a very small, standalone nonprofit who has been providing care for the medically compromised for over 40 years. This staffing legislation would devastate us financially to the point of having to close our doors. As we prepare our 2021 budget and consider this proposed legislation, it would impact us by an additional 35% in cost added to our budget per year for staffing, which we cannot afford. This would be a huge financial challenge as there would be no additional funding granted to us in long-term care to assist with the cost of the increased staffing needs. We're also challenged with finding the staff to meet these needs. Through the COVID-19 epidemic, it has been very difficult to hire and retain staff in our community. When a position opens, it can remain not filled for months before finding a qualified individual to take the job. The proposed legislation would cause undue strain to our community here at John Clark and potentially cause our residents to have to relocate to another home if we're not able to keep our doors open to care for our residents. I don't want to imagine the emotional turmoil that the residents and their families would experience having to say goodbye to their home and the caregivers here at John Clark. Thank you for allowing me the opportunity to testify tonight.
Thank you. Are there any questions? Thank you very much.
No, thank you.
Yep.
Take care.
Bye-bye. So next, Virginia Burke, Rhode Island Healthcare Association. Virginia?
Yes.
I'm sure you've heard me ask for people to be brief, and Scott started with this, so if you can just align yourself with that testimony.
I can understand your mistrust. I've been known to expound, but I will be brief. I'm Virginia Burke. I am Scott's predecessor at RICA, and when COVID struck the nursing facilities, they asked me to come back and do some consulting work for them. I ended up trying to help them with this proposed bill. I'm really sorry to hear that the notion that the nursing homes made over $200 million in 2017 and 18 still exists out there. It's simply not true. The cost reports do not say that. The cost reports, whoever says that they do, is misinterpreting them. And I would hope that before the committee would consider passing a bill that would be economically devastating for the facilities, you would sit down with the cost reports or an owner. You don't need an accountant or a CPA to tell you. It's demonstrable from looking at the cost reports. They don't show profits. And the nursing homes did not make millions of profits. In fact, over that 2-year period, they sustained industry-wide a loss of $7.9 million. They did get millions of dollars in federal relief for COVID, and that's why they're still open. That money is keeping them alive. It's a one-time infusion. It won't be there next year. Hopefully, there won't be COVID next year. And they just don't have the resources to increase staffing to the level you're asking them to do it. It's just not there. I was president of RICA in 2012 when the state unhooked the rate calculation from the costs of care, and I've watched their shortfalls grow every year. I could go on, but I just wanted to make those 2 important points. Thank you.
Thank you. Any questions for Virginia? Then we'll move on. The next person we'll try to connect with is Gerald Goulet from Health Policy Analytics. Gerald?
Yes.
Go right ahead.
Good evening, members of the committee, Mr. Chairman. Thank you for the opportunity to testify. I'm speaking on Senate Bill 002, and my testimony is to a very narrow point. I guess I should start by giving my credentials. For the last 6 years, I've been involved in healthcare policy, either as a regulator with state government, as an attorney for hospitals and nursing homes on regulatory policy, or as a private consultant. And I'm only speaking to the point of whether the 4.1 minimum staffing ratio is a federal law or regulation. people have called me and said that that's been raised at previous hearings. I just wanted to, I think Jason Traporton referenced it a little while ago, but essentially Congress asked the federal government, the then Healthcare Financing Administration, now CMS, to look into whether it would be appropriate to have minimum staffing ratios in order to improve quality. That was back in the early 1990s. They requested that a report be given to Congress by 1992. Well, the initial report came out in 2000, and the first draft of that report essentially was problematic from a methodological viewpoint. So they commissioned Apt Associates, a consultant group out of Boston, to assist with the second report. And these reports comprised like 6 volumes of data. Apt Associates did methodologically improve the report and submitted it to the Health Resources Services Administration. The Department of Health and Human Services, which was then headed by Tommy Thompson, took that report, which did not include recommendations. It only pointed to the fact that a range of staffing thresholds between 3.55 and 4.1 on the high side could possibly lead to quality improvements. Secretary Thompson issued a final report and sent that to Congress, and specifically noted that the consultants, there were lots of problems with the data, and that it would be improper to conclude that the staffing thresholds described in the study should be used as staffing standards. He sent that report in December 24, 2001. He noted that the analyses did not take into account facility management, organizational structure, tenure and training of staff, mix of staff by type and level of experience, all of which were likely to affect quality independently of staffing level. It also didn't reflect on the existing nursing shortage, which obviously persists to this day. So, in his report to Congress, the Secretary said that the appropriateness of establishing minimum ratios was not satisfactorily answered. It wasn't answered 20 years ago. Congress did not adopt them, and so the federal standards are the same now as they were prior to 2001. No state has ever adopted 4.1, and it is something that people refer to in studies now as a federal consultant posited 4.1. They never talk about the range from 3.55 to 4.1. And so to the extent that this misinformation is being circulated, I just wanted to clarify that that standard does not exist at a federal level.
Thank you. Any questions? Thank you very much. Next, we'll try to connect with Matthew Trimble from St. Elizabeth Community Homes. Matthew, could you please turn down your broadcast as we can hear the delay on that?
Yeah.
Thank you. Go right ahead.
Thank you.
Go right ahead.
Thank you very much. My name is Matthew Trimble. I'm the President and CEO of St. Elizabeth Community. And I oppose this legislation for all the reasons already stated. But I would like to put a little different spin on my testimony. Over my 26-year career in the industry, my 2 facilities have cared for many family members of Rhode Island's current and past legislators. We've recently gone through a significant COVID outbreak in both of those facilities. I can tell you that staffing levels does not guarantee that a facility will be unscathed from this terrible virus, and that the timing of this bill, as already previously stated, is certainly unconscionable. We all understand the union's influence on politics, but please remember, they are in 6 facilities out of the 79 in this state, and 100% of the people who run these facilities and know the business oppose this legislation. You have heard some very drastic differences in both data and statistics from the sponsor of this legislation and the people who work in it. I would urge the members of the committee to please do not discount that. Before you vote, please seek the truth on the data and the stats. I was pleased that the House did not vote in favor of this bill and decided to study the issue. And having been asked to be a part of that study group, I am optimistic that they are looking to seek the truth between what the sponsors say and what the industry says. So please, I encourage you to do your homework. There are basically 2 accounting firms in this state that do the audited financial statements for most of the nursing homes in this state. Please speak with them. I would also like to point out something that was said earlier. The state of Massachusetts did pass a staffing ratio of 3.58, but they also added $90 million in funding to the Medicaid system. Let's work together on this, not force us with this bad legislation that 100% of the industry opposes. Thank you very much for allowing me to speak.
Any questions? Thank you very much. Next, we're going to try to connect with James Nyberg from Leading Age RI.
Let's work together.
James? James?
Hi, Chairman Miller.
Yeah, can you turn down your broadcast so we don't get the delay on that?
Yep.
Okay, thank you.
Sorry about that.
And you know, Scott and others have made a case, so I want you to, be brief in your testimony, if possible.
I will. That came through loud and clear.
Okay.
Leading Age, as you know, represents nonprofit nursing homes, and so on behalf of my members, I just want to thank you and the committee for this opportunity to express our opposition to this bill. Like I said, I will be brief, but there are just a few things I want to highlight. As you heard, the current 4.1 ratio is unprecedented for any state and is practically infeasible. But I also want to emphasize that the federal government explicitly declined to endorse the staffing ratio mandate when they did a huge update to the federal nursing home regulations just 4 years ago. So I think that's important to point out. When we're talking about the financial distress of nursing homes, I had a member of Hallworth House close last summer because of ongoing financial struggles, and COVID put it over the edge. I would also note that was a higher staffed home, but still got wiped out by COVID. And there is an emerging body of research about COVID in nursing homes, and it's showing that the number one predictor of an outbreak in a home is community spread, not staffing, quality, or other things. And that's to the extent that there's any rhyme or reason as to how or when COVID gets into a facility. People talked about workforce, and I think unless we address that, we're just setting up facilities to fail with this bill. I feel that the bill just imposes a ratio and is punitive and not collaborative in terms of finding nursing homes and even kicking them out of Medicaid, which would not help quality or access to care. And one last thing, we talked about the distortions of nursing home profits that some entities are making, but they can easily be disproven. My written testimony has an appendix that shows an example of how the financial condition of at least 2 of my nonprofit members has been misrepresented, using data that they file with the IRS in their Form 990s. So I think in lieu of this, instead of this bill, we need a broader-based review of the industry, including the reimbursement methodology, to better fund and incentivize nursing homes to maximize staffing. We'd be happy to work with any and all stakeholders on this, and thank you for your interest in this issue.
Any questions for Mr. Nyberg? Thank you very much for that testimony. Next, we're going to try to connect with Emmanuel Falk from SEIU. Mr. Falk? Go right ahead.
Thank you, Chairman Miller, members of the committee. Emmanuel Falk, SEIU 1199. We provided written testimony a few months ago over the summer, and I want to just update a few things that have changed since then. 1,230 Rhode Islanders have died in nursing homes. We're the third highest in the country, as the whip mentioned. So I don't understand bragging about infection control. It's a little confusing. There also have been numerous studies that have come out, including one from the Harvard T.H. Chan School of Public Health, that have basically said there's a growing trend that COVID infection rates go up in facilities that have lower staffing. And we know from CDC data on other infections, other diseases, nursing homes with better staffing have less of those problems. So we've needed to staff better for a long time. One of the reports that finds the link between higher COVID rates and lower staff facilities was one of the authors of those was Charlene Harrington, who is an expert and was mentioned earlier. Charlene Harrington, Dr. Harrington, also spoke at a press conference for Raise the Bar, which we're part of, the coalition supporting this, back in the spring in support of the legislation that the Senate passed last year. You're basically looking at the same bill. We've changed some of the implementation dates. Why did we get involved in this? We heard a call from our members. We did a survey. Their number one issue usually is wages. This time it was staffing. And you talk to any nursing home worker that's been doing this for 12, 15 years, they'll tell you they took care of maybe 8 or 9 people on a shift. Now we're looking at 15, 16. Some facilities do better, but that's what we're hearing from our nursing homes, and I would believe the heroes that tell us that. So what has happened over the last few years? Nursing homes have squeezed more and more profit out of staffing less, and we need to reverse that trend, and this bill begins to do that. We also need a leveling of the playing field. We have nursing homes, and I don't know if they support the bill or not. St. Clair's, 4.7 hours on average. And then we have nursing homes like Cramar, Apple, and Westerly that are at 2.5 hours. Which makes you wonder if some of the residents there are basically getting assisted living level of care, in which case they probably should be in assisted living. So there's been a lot of talk about the timing of the bill. The timing of the bill cannot be better to pass. The heroes have been clear. Residents have been clear. Family members have been clear. Staffing is awful in the state. The CMS data proves it. 41st in the country, worst in New England. We need to build a more resilient nursing home system, and staffing is foundational to quality, safety, and retaining a good workforce. So people keep saying that, there's not enough people to do the work. Basically, a third of the CNA workforce drops out of healthcare in Rhode Island. And we'll let people decide on their own what some of the reasons are, but when the median starting rate is $12.73 for a CNA in nursing homes, and the minimum wage in Massachusetts is $12.75, I think that's part of the answer right there. We need to increase pay. There is a component of the bill that takes scheduled increases and requires them to go directly to frontline workers. That includes cooks and EVS staff. I know one of the administrators or representatives of a nursing home brought that up. They are included in that legislation, laundry workers as well. At CIU 1199, we buried 2 members in Rhode Island from COVID that work in nursing homes. We're seeing more and more mental health. We're going to have a mental health crisis with this caregiver workforce, union, non-union facility. We need to let caregivers know that policymakers care about them and they're listening. And what they're saying, along with residents, is we need better staffing. We've needed it forever, and this pandemic has shown why we need even more. So, and I'm sorry to get a little emotional, but when you hear some nursing homes are paying triple and double pay to agency, it really makes you wonder what the hell is going on in our nursing homes, or some of them. So the timing could not be better. The first phase of vaccinations are almost done. A lot of our members, a lot of caregivers have gotten their second shots. Same goes for residents. That's going not as smoothly as it could, but it's on a good trajectory. So now is the time to pass this legislation. More than ever, we need it. That's what the heroes want. A yard sign that says, "Thank you, workers," isn't going to cut it. Let's pass the bill again. Thank you for doing it in the summer. I want to thank the committee, and I want to thank the Senate, and I hope you do it again. Thank you.
Emmanuel, I have a question about recruiting workers. Do you feel that you have the capacity to re-enlist people who have left the industry, and that this legislation will help you do that?
I think it's going to, yes, I do. I think it's going to be, it's going to be a slow path back. What happens is a lot of CNAs, they go through the DLT program, or they go through one of the, Genesis, as mentioned, does their own training. We have older members that recruit their nieces, their daughters to do the work. They show up, they make the pay, dealing with, loneliness, excrement, deaths, and even in non-pandemic times. They get paid less than $13 an hour, around $13 an hour, and they're taking care of, 14, 15 people. So people aren't going to do this work until we change that, until we improve staffing and we make wages better. So we have to pass this bill.
And also, Emmanuel, I want to address the issue you brought up about other staff in nursing homes and the concern that it could take away from them. Do you think there are enough protections in this legislation to protect other staff in the nursing homes?
I think we need to increase wages, which is what the bill does. I think part of the problem is with the nursing home industry, there seems to be a business practice of not giving people full-time hours, so people are also wandering around. I think we need to change that. I think this bill helps retain people, and I think if you start paying people a living wage for this really hard work, and you give them a reasonable workload, people will come back to the work, and we'll get new people to stay and continue to do the work.
So you think there are people in the nursing home staff realm that are less than full-time, and part of the absorption of workers will come from people who are already on staff that will go from part-time to full-time?
I think so, because a lot of the part-time workers are working full-time. They're just working at multiple facilities. So, I think it's probably an older workforce, and there's not a lot of young people that stick with this, because I hate to be a broken record on it, but the starting pay is awful, and the workload, because of the lack of patient staffing ratios or staffing standard, is just not there, and we need it. And we're 41st in the country. And I know I finished my testimony. I'd like to add one thing. The state has provided Medicaid increases for the last 5 years, and there have been federal Medicare increases the last 5 years. So to keep saying that there's been cut, it's not true. And 1 out of the 5 years, it was a level funding.
Thank you. Any questions for Mr. Falk from the committee? If not, thank you very much. Next, we're going to try to connect with Any luck with Senator Mendez? No. Dawn or Claire who's a CNA? Dawn,
Yeah.
thanks for joining the committee.
Oh, hello. How are you? Thank you for having me.
Go right ahead.
Oh, go ahead. Okay. Hello, everyone. My name is Dawn. I'm a CNA for the last 21 years at Hopkins Manor. Over the last 20 years, I've seen a major decline in staffing levels that has seriously affected our residents. When I first started this job, the ratio was probably 1 to 8. Now, I go to work, the ratio could be 1 to 13. At a ratio of 1 to 13, there is no possible way that we can go to work and do our job and give our residents the dignity and the respect that they deserve. They're waiting on time to eat and their food's cold. Some are losing their dignity because we can't get them to the bathroom on time and they're messing themselves. And we've been trying to fight this bill for the last 19 months, and it's a no-brainer. Our residents deserve quality care. And, now that COVID had hit, I've seen it's made the job so much harder for our residents. We are working them like they're a factory line, which is not fair to them. They deserve to have our attention. They have no family members that are in there. And then what makes it even worse right now is that when our residents pass on, even now, we have got to bag their bodies, zipper that bag up, and bring that body downstairs to the funeral homes. And, it's heartbreaking when you make a relationship with these residents, and then when they pass on, we have got to bag them. I mean, this is uncalled for. Our residents deserve quality care, and they deserve it now. And the only people that can change that is you. And we need you, and we need you to change it now. Thank you.
Any questions from the committee? Thank you very much for joining us. Next, we'll try to connect with Stefania Silvestri, registered nurse. Stefania?
Hi.
Go right ahead.
Hi, my name's Stefania. I'm a registered nurse. I've been in the healthcare business since 2002. I started out as a CNA. I was a CNA for 12 years, went ahead and got my registered nursing license. Since I've been in the nursing home industry, it seems that there's more of a demand of patient care. More patients are coming into skilled nursing facilities. They're living longer. They require, there's more technology now where we have these patients who are sicker. During COVID, before COVID, we were short-staffed, but we have significantly decreased the staff now, even more. While we were in COVID, there weren't enough staff members, nurses, or CNAs to actually help very, very sick residents. It was like I was being pulled in one direction to another direction, and I just couldn't help them all or meet their needs. I ended up contracting COVID and giving it to my husband. My husband ended up losing his job over it. We lost our medical benefits. I have a medical condition that requires me to go to the doctor every month. I had to pay out of pocket. It was difficult. I had to work more, but I still couldn't provide for the residents the way I wanted to. We're not meeting their basic needs as humans. And now they're alone in the nursing homes. They can't visit their families. They can't come out of their rooms. They're all alone, and all they have is us, but there's not enough of us. If you can't meet their basic needs, in my opinion, that's neglect. These residents depend on us to help them, and something as a simple task as buttoning up their sweater or going to the bathroom, they have to wait sometimes anywhere from 20 minutes to 45 minutes, depending on how much staff. If there's one CNA or two CNAs on the floor, recently, there'll be two CNAs on the floor for 29 patients. How do you help them all? Because they're always needing something more than one resident at a time. It's really not fair. We really need to do something about this now before anybody else is neglected or hurt or something else happens that's important. You know, it takes a lot of caring and compassion, and we have to empathize with these residents that are in the nursing homes right now, and they don't have anybody but us. I think that's all I have to say for now. My important points is that there's not enough staff members, and these residents are being neglected of their basic needs. Thank you.
Any questions from the committee? Stefania, I want to thank Senator Bell.
Just very quickly, I wanted to thank you for your testimony. One thing you mentioned really stuck with me, which is that, you know, when your husband lost his job because of COVID, which is horrible, no one should be losing their job because they get sick, you know, and that's a sign that our sick days protections are not going far enough. But one thing that really struck me is that you mentioned that meant you lost your health care. Do you not have health care from the nursing home where you work? Do they not provide that? And when your husband lost his coverage, were you not able to qualify as a qualifying event? Because that, you know, that would be really extreme mistreatment of workers by the nursing home. So I was just wanted, you know, to ask if that's really what they did to you.
I'm still here.
Yeah, you can go ahead and answer the question.
I didn't hear the question. I'm sorry. I didn't hear anything.
Okay, so you can go again, Sam, and let me know if you can hear it. If not, I'll try for you. Go.
Okay, so just very, very briefly, I'm so sorry about what happened to you, and I just wanted to make sure, did the nursing home where you work actually not provide you medical benefits, so that when your husband lost his coverage, you weren't able to, you were uninsured? And did they not allow you to sign up as a qualifying event, or was the healthcare coverage so poor it wouldn't have made sense?
So I'm not a full-time employee there as of right now. Like I said, I have a medical condition. So sometimes I can work more than others. So I work per diem there. I pretty much work at least a few days a week, but recently I have a wound on my leg. So I've only been working once or twice a week right now until I have medical now, thank goodness, and I've been getting wound care regularly. So right now I'm not working full time. But I'm not entirely sure. I didn't look into what they would provide. I know they don't provide medical benefits unless you're a 32-hour-a-week employee. And I know there's an enrollment period, but I'm not entirely sure when that starts either.
Well, thank you so much for your answer. I do have to say
You're welcome. Thank you for taking the time to listen to us.
You know, I know it's common.
I appreciate it.
But I think
hopefully we can do something
the idea that there are people working in nursing homes
to change the way things work right now.
And health insurance coverage is concerning.
Are there further questions? Thank you.
Thank you very much.
Thank you for calling in. I think the last person we have on this legislation is Marjorie Water from Rhode Island Organizing Project.
You done?
Marjorie? Marjorie, could you turn your computer down?
Hello?
And, oh, there we go. Thank you. Go right ahead.
Hi, my name is Marjorie Waters, and I work with the Rhode Island Organizing Project. I've been working for Voices for Better Health, which is basically working with seniors and disabled adults and listening to their concerns as they face the challenges of disability and aging. I have listened very carefully to the testimony today, and I can agree on certain points from the nursing home testimony. Medicaid needs to reimburse at higher rates. The workers need better pay. And we need to increase the hours per 24 hours. I have spoken to so many people who have people in the nursing homes, my own experiences, and what frightens them the most right now is even before COVID, they were often visiting to supplement the care that their loved one was getting. You know, washing, bathing, doing all the things that the staff simply cannot complete in their shift because of the patient-staff ratio. So I hear and empathize, but my empathy is saved for the residents of these nursing homes who are now isolated and alone and have a staff that is harried and overworked, and this must change. COVID has laid bare some of the issues, you know, that we have in our nursing homes. We must find a way to address these. I do not want to see one facility close, but I do not want to see one patient who does not have the chance or the opportunity during the day to be bathed and dressed and fed if necessary, and even perhaps just a little bit of conversation, because right now the only conversations they're having are with the staff. So I can personalize it. I had a good friend in a nursing home. I talked to her daily. She was aware that the nursing home was understaffed. She contracted COVID while there. Luckily, she didn't have a serious case of it. But I think we all need to consider not the financial viability of nursing homes, but also we must consider the patients, their friends and family who right now cannot see them or help, and they have helped. So we're hearing from lots of people in the community of great concern. Every single one who I've asked the question, do you think there is adequate staffing in nursing homes, has said no. Now, I will remind you, this was pre-COVID, before the COVID pandemic hit. So I think where we stand now is we've been advocating for loved ones and people we know who have family in nursing homes. I want to advocate for every single person in a nursing home today, because so many of them have no family and no friends. And we all know that it can exacerbate or create mental health issues in addition to the other morbidities that that patient has. So I implore everyone here today to think out of the box. How can we make this happen?
Marjorie, you faded off. Are you finished with your testimony, or?
No, it's hold. So I understand that this is a real challenge for nursing homes, but I think if they look deep down inside, they understand why this is absolutely necessary. To their point, nursing home availability will be an urgent need in coming years, so let's get it right. Let's make sure that nursing homes have the financial backing from Medicaid, have the right patient-to-staff ratios, and that the staff is paid a living wage so that they are not worried about their family and how they're going to feed them and how they're going to provide medical coverage and the other issues that have been raised today. So I thank you for allowing me the testimony, and I do hope that you will pass this bill. Thank you.
Any questions for Marjorie from the committee? Senator Calkin.
Thank you, Mr. Chair, and thank you, Marjorie, for your testimony. I think you brought up a really important point in addressing the human interaction of all of the nursing home patients. We know how isolating it can be with COVID, being stuck home alone, and it makes you think about, if you were a patient in a nursing home and having so limited interaction with other people, how that can affect you for your mental health and other things. I guess my question would be, if there is a question other than just saying how important it is, I think, to have that interaction. Do you have any idea of how much interaction, like a typical patient can get with the staff, and what it would mean to pass this bill and how things could improve for those patients?
I understand that it's minimal only because it is very difficult for some staff in some nursing homes to even complete the ADLs. Getting them up, getting them dressed, getting them fed, getting them washed. So, somebody mentioned, and I won't go so far as to call it an assembly line, but I think that it's all consuming to get the physical aspects of the patient taken care of, but the emotional needs of the patients are not being met because they are cut off from family and friends. So to give that staff member the extra 5 minutes or 7 minutes to talk to that patient as human to human, I think right now is critical. So I agree with Emmanuel. This is the right time for this bill.
Thank you, I appreciate that. No other questions?
Thank you. Any other committee members before Marjorie gets disconnected? If not, I would like to make a few comments before we do a motion on this bill and go to the next bill. We've heard 2.5 hours of testimony tonight on this bill, and this bill should not be separated. It was one of the last major hearings we had last year was this bill, and it was several hours on that. So I want everybody who's looking at the history of this bill and how seriously we consider it, and whether 2.5 hours was enough. We have 100 pages of testimony. We have last year's hearings on this bill. We have a lot of discussion in the interim. So it's not a brief decision on this bill or any other. I'd also like to bring up the point, and I believe I brought this up both on the floor and before we had a motion on this bill last year, is that we just had a study commission on reimbursement rates, and it went on for a very long time. And it wasn't only about nursing home reimbursement, it was about a much wider realm of health care. And Rhode Island has historically low Medicaid reimbursement rates. And nursing home facilities are not to be left out of that. They are actually one of the better representations of versus other states of similar demographics, and we have one of the highest demographics for those who are in nursing home care. That we do have a rate that is much lower than other states and much lower to the care that's given, which is a hindrance for them to operate effectively. But we also do have both nonprofit and for-profit nursing homes, and those delineations are very clear to anybody who's looked at how not only nursing homes are organized, but many structures throughout the state that have to do with nonprofit versus for-profit operation. And there is not a for-profit operation unless there's a profit. And so how it's structured is very reliant and has to be considered based on what Medicaid reimbursement rates are, but it's a very important consideration that Rhode Island is on the low end, and that should be repaired not only in nursing home, but in many sectors of healthcare and beyond healthcare. And then the COVID component. We're going to hear Senator Lombardi's legislation after a short break, and I will tell you from personal experience, my mother-in-law died in a nursing home in March. It was not COVID as far as we know, but we weren't there and we weren't allowed to be there. And that many people do not only understand and assist in that care because they're able to have access, and we'll hear that kind of testimony. But it's a real issue, and it's an issue that exacerbates why this kind of legislation should be seriously considered, is because there aren't those eyes in the nursing home other than staff. And those eyes alone can be an important component of seeing not only the care for your loved one, but the care for the loved one in the next bed or the next room. And not having those eyes there is a very important consideration when you consider staffing levels. With that, is there a motion on this legislation?
Mr. Chairman, I move passage of Senate Bill 2.
Is there a second?
Second.
From Senator Bell. Will the clerk take a vote?
Senator Bell.
Yes.
Senator Culkin.
Aye.
Senator DeMario.
Aye.
Senator Golden.
Aye.
Senator Lawson.
Aye.
Chairman Miller.
Aye.
Vice Chair Valverde.
Aye.
So this bill will be moved to the full chamber for a vote.